What the fuck do you mean Charlie Kirk got shot? Are we talking hypotheticals, or did some asshole actually pull a trigger? If it's real, holy shit, what the fuck happens to the human body when a bullet goes through soft tissue and organ systems? How does a fucking projectile convert kinetic energy into destruction inside someone's torso or limb? And why the hell does that sometimes kill and sometimes leave you walking around like a half-broken clock? Think about bleeding exsanguination. How many liters of blood does a person have? And how long before losing consciousness when you start ripping out that precious red fluid? Why do some wounds clot like stubborn little soldiers while others just keep pouring like a busted faucet? What the fuck is the role of the vascular anatomy and pressure gradients in dictating survival? An infection, why the hell does a bullet wound become a festering nightmare if not cleaned properly? What microbes hitch a ride on that metal and debris? And how does the immune system decide whether to overreact or flop like a drunken boxer? Why do we sometimes see sepsis days later when everything looked okay in the emergency room? Then there's the neuro shit. How does damage to peripheral nerves turn someone into a numb, burning ghost of themselves? Why does a severed nerve sometimes regenerate and sometimes not, leaving permanent deficits? What does that do to a person's identity when they can't feel their own goddamn hand? And psychologically, how does surviving a shooting reshape the brain? Why do some people become hypervigilant, scanning every corner like prey, while others dissociate and feel nothing? What the hell are we doing as a society when we let violence be so commonplace that people have to relearn how to be human after a trauma? If this is hypothetical, what would we do differently as medics, as bystanders, as a community to reduce the odds that anyone else becomes a bullet-ridden motherfucker? If it's real, who the fuck is safe, and how do we stop asking that question?